Thank you very much for this introduction. So this is not a scientific talk. It's more like an educational project which was supported by the foundation, and I've been asked to present it. So this was started a year ago because my lab had a chance to be nominated as Center of Excellence, so we must conduct actions in 3 directions: clinical, preclinical, and educational. And for educational, we propose to design a MOOC to promote the therapy by ultrasound. So what is a MOOC? It stands for a massive open online course. Massive in the sense that we should be able to reach as many people as possible. Open in the sense that it should be free online, and of course because we provide educational information. So what is important is that every MOOC is focused on a specific domain. So in our case, it's therapeutic ultrasound. It's available for a specific period of time. So we will show courses until March, but we'll probably renew the experience if it's working well. It must be interactive, so I'll show you how. Free, I say that, and we will try to reach an audience as broad as possible. So in this MOOC, you will find different presentations, a combination of clinical cases and technical topics. We try to cover almost, well, not everything because it's too broad as you've seen during these last days, but many presentations on thermal ablation, drug delivery, talking about the mechanism of actions, the bioeffects, the different monitoring modalities. These presentations are given by both MDs and PhDs. So I think the next slides are the speakers we have. You may know some of them, I'm sure. Jeff Elias, Alexandre Carpentier, Sébastien Crouzet, Peggy Gadouni, Franco Orsi, and Florent Aptel. And for the MDs, we have Oleg Sapochnikov, Lawrence Crum, Gael Terrar, Shinichiro Memura, Bruno Quesson, and Kurt Moonen. So the audience for this course are mainly medical doctors and students. So really the idea is to promote the field. PhD students, I think it's interesting for them to have a broader view of what they're working on. And eventually patients. I mean, it's really open, so patients can connect and ask questions over there. The language is English, of course, no worries. So we also like to have this interactive. That's really the purpose of a MOOC. So we have questionnaire at the end of each presentation. Well, you don't have to do it, but it's better if you do it. So this way we assess how clear was the message. We have a forum for discussion, and we can provide additional resources like references or information from manufacturers. I mean, anything which would be interesting for the doctors using this MOOC. When and where, so it's already started. We have 2 courses which are online, the one by Jeff Elias and the second one by Oleg Sapochnikov. There will be another one early next week by Gael Terrar. It's a collaboration with the University of Lyon, so we use their online platform, which is called Cloudline. So the link is a bit long to register, but I really recommend either you find a link on the website of my lab, or you go through the newsletter of the foundation, which provide information on this MOOC. Very briefly, when you click on this link, you arrive on a registration page where you can just identify yourself. And then after you have an access of this sort of page, where on the top you can see the different courses. So, well, obviously right now you have only 2, and very soon 3, but very soon you have all of them. Once you select a course, you can find the title, of course, summary, who's the speaker, and then you have different video, just like Larry Crum here, talking about cavitation, which is exciting, passionate. So, and after you can go get quiz and little awards if you're successful. So I think I'm pretty much done. Yeah, I hope you'll connect and enjoy this experience with us. Thank you very much.
Questions? So are the courses downloadable?
There are YouTube links. I think you can download them. Didn't try it, but you can download probably. And I know that some master classes are using them for courses.
Do you enable adding translation subtitles for people around the world?
Well, it's in English. That could be something we could do. You mean, which language would you think of?
No, you can let the community translate it and add it.
Yeah, it would be possible to do that.
Any other questions?
Thank you.
Thank you.